Now, this will be implemented by the Ministry of Health through the Birth and Death Registration Unit with funding from the World Bank. Now, this exercise will commence on August 1st, 2022. Now, on my immediate right, I have Modu Njai, who's the Director of Health Promotion and Education. And on the far right, we have Jibril Jaji, who's the Director of Planning and Information. On my immediate left, we have Lamin B. Fati, who's the Registrar of Birth and Death. And we have, on my far left, we have Lamin Sedikan, a Logistics Officer at the National Health Insurance Scheme. Gentlemen, welcome to the program.
Thank you very much. Thank you very much.
Unfortunately, we don't have a lady here, so I almost said ladies and gentlemen, but welcome to the program.
But next time you will get one.
Yeah. Okay, now let's start off. This exercise has already started.
Yes.
They have gone to different regions and different areas. I've seen them in my area. Now, there were quite some technicalities that were occurring. I would like to start off with Jibril Jaji, who's the Director of Planning and Information. To clear off the rumors, some people were saying that there were technical issues with regards to the connection of the internet, the software, things like that. Can you please clear the air on what are the technical issues that were actually occurring?
Thank you very much, by Ibrahim. Very interesting to actually, understand that these are some of the issues that have been said. You know, the innovation we are in has to do with the creation of the most important thing is a unique identifier for every Gambian. And in any campaign, if you are to issue a unique identifier, meaning it has to be on a live server, so that there will not be any duplication of numbers in terms of identification. What we want is every Gambian to actually have one unique identifier. And that cannot happen if you have over 56 centers and you want to actually go offline. And you will realize that people will not get actually their cash on time. This is why we are running this campaign on live on and issuing of the certificate on the spot. We all know the challenges that the country is facing in terms of internet connectivity. But that has little to do with our technical preparation as a ministry to embark on this campaign, to make sure that also this campaign is actually successfully implemented. So it is true that some of the issues that we have faced as a ministry is slow internet connectivity, and we have huge investment in terms of internet connectivity to make sure that all the teams across the various regions, do the registrations well without any internet interruption. But unfortunately, the campaign started when we experienced unprecedented downpour of rain, and then it has affected telecommunication infrastructure, that affected internet connectivity. But the system itself we are using has no technical
malfunction.
No malfunction. Since we started on, it's 1 month, 2 days. So in terms of technicalities, that's the only issue that we have faced. But the system is well and is running well.
Okay. Mr. Njai, we do understand that there were a whole lot of people going to the places at the same time, and the queues were very long. That actually propelled a lot of anger from people. Now, can you tell us what is the necessary procedure that your ministry advised the officers on the ground to actually take, and what will you advise the people who go to the ground to actually get themselves ready?
I think that's a very important point you highlighted. When the campaign started, not many people were aware of it because they were waiting for the schedule. and then the ministry, in collaboration with our partners, were able to develop a schedule, and the schedule was publicized. And then as soon as the schedule was publicized, and then people started coming in their numbers. And then they were also following the schedule. Like, for example, they will know, for example, day X, where the teams will be and for what period. And then this was really followed, and we have to thank the public for really responding and to our call, because we developed it, we prepared the schedule, we shared the schedule on our platform, Minister of Health Facebook page, and we also use our 1025 now to receive complaints and concerns raised by the public. And that was, we are very transparent when in terms of sharing information. So whatever information we have, we send it to the public, and we also alert one of our areas that will be able to at least get the information, whether it is pleasant for us or it's not, but at least this is what we use to gauge our performance and also for us to be able to move forward. And then when the messages were sent out, then people came out in their numbers. And you can see that the queues were always there too long, and then people stayed there for a longer period. And I think, as Jibril mentioned, most of those waiting time were long because people were not, I mean, the internet services were really very slow. And then it doesn't mean that it is the people who were slow, but in the actual fact, it was the internet. Like, everything has to go with internet services. So, and then that was why many people were not definitely patient enough to wait, and then they have to break the queues. And then some communities were very, pleased with those communities. They were able to control, the VDCs came out in their numbers, and they were able to support our team members to at least to manage and also to arrange the queues. But in certain communities, that was not the case, and that is where we had challenges. And some people came with anger, and at some point we have been told that some of them have to even to go and destroy some of our gadgets, because they were angry that they have to be in the queue, and then they were not served, and then they had to even attack our staff. Some even have to attack the police officers. That is uncalled for. And then, but as we're also moving on, we also try to strategize and talk to our team members, the supervisors and also the coordinators. We have this daily coordination meeting, and every day when issues come, we discuss them, and we come up with action points. So some of those action points, they are normally being implemented, and that is why we had some of these challenges were addressed. But the advice we normally give our team members is that they have to make sure that the elderly people, the pregnant women, and people with children, they are also given at least sort of a priority, and then also because other people are there who are young, and some of them they can wait. But pregnant women, women with children, and also elderly people, and then we advise them to at least consider those people when they come to the queue. But when other people see women coming with their children, or maybe especially with young babies, women with young babies, or pregnant women, when they see them being fixed into the queue or being supported to be part of the queue, or to come and given priority, then some people will not understand.
And they get
angry. And then they start attacking our staff. This was the problem. But I think that for us, we are very much concerned with pregnant women and also women with children and also the elderly. So that is why we had to give them that, and also for them to also know how to approach people when they, especially the community entry point approaches.
The flow of people quite. People can go, get themselves done, and get back out.
That is exactly what we have finally done that by also we included the security among us. So the security, we are working with our team members together with the village development committees to make sure that the queues are well managed. And that was really, really something that we have. I think that was a good practice.
Did it
and
improve?
I think it has really improved the service, and also people were also not in a haste, because they know it's first come, first serve basis. So when you come, if you come last, you have to stand behind the queue, because there are people also who are monitoring you. So when they monitor you, they know that you've just come in now, you cannot be served early. You have to, your concern will not even allow you. You have to go back to the queue. But some of the VDC, Village Development Committee members, were very helpful. We have to talk about that. Definitely, some of them were very supportive to our team members.
Okay, great. Now, moving on to the registrar himself of birth and death, Lamin B. Fati. Now, can you please tell us who needs to be registered on their birth this thing and their health insurance scheme? Because people think that only people working in the government are the ones allowed to have this national health insurance scheme. Is it for the whole nation? And how and who will be required to actually get this?
Thank you very much, Bai. It is important for us to know that birth registration is a legal identity, and everybody is entitled to a name, a nation, and a sense of belonging.
Yes.
So this is a confidential record that the government of the Gambia need to keep in place. in accordance with the international standard, that it should be continuous, permanent, and then confidential, that everybody is entitled to a name, a citizenship, and also a sense of belonging. So therefore, birth registration isn't a new thing in the system, and also coming up with this new strategy is only transforming from manual registration that we were doing and an elongated format that we were doing before. Now we want to transform that to the electronic one, and then it will be A4 size, more manageable, and then more appreciative in terms of international standards. That being the case, that every individual in the Gambia, every Gambian or anybody born in the country is entitled to a birth certificate. And even Gambian born outside the Gambia are entitled to a Gambian birth certificate because they are Gambian by descent. They are all entitled to birth registration certificate. They will also be registered and be issued a birth certificate. Even Gambian children born to non-Gambian parents, they are entitled to birth certificates because you must align them to their parents. And then legally aligning them to their parents is to produce a birth certificate that indicates their place of birth and also who the parents are. So that's why it is it's legal for every individual who is a Gambian to be registered. In this new approach that we are saying, even if you had an old birth certificate, we're here to transform from manual to digital. So everybody is inclusive, irrespective of your age, irrespective of whether you're working in the government or not. And that's why even this community approach, we're taking, even our primary target is only the communities first. We don't give a privilege yet to the government workers. We said, let's target the people who are more vulnerable. We think that at the community level, not many people have their legal document or are legally documented. That's why it is necessary for every individual to come on board and be registered and be issued a new birth certificate. If you have the old birth certificate, you come with that one with a supporting document, like the identity card, so that the NIN will be inserted, incorporated in the new one, and you'll be given a new birth certificate. And that's the way. If you don't have that old birth certificate with you, what you need is attestation from the community head, that is the alcalo, endorsed by the district chief, and then you come with that with the parent supporting document, and you'll be registered and be given a birth certificate. Once your nationality is identified that you're a Gambian, it will be given to you. If your nationality, even if you're born into a non-Gambian, but you're born in the country, the nationality will be spelled on the certificate of your parents, but you'll be given a birth certificate. So therefore, every individual is called for to come on board and be registered.
When will the old birth things be invalid?
No, we are not invalidating that one yet because it's a legal document.
Okay.
Why we're doing this new registration is that data archive, data should be there permanent. That's why I mentioned in my introduction to say that registration should be permanent, continuous, and confidential. So our challenge is this. One, the government is not having a data on its population, dynamics, and how many people are born in the country, and that also affects in our planning processes. Even the healthcare delivery that we want, efficient healthcare delivery, you don't know proper statistics. You cannot plan better for your country. Therefore, it is essential for government to be registered. Likewise, the others in terms of even school enrollment, we don't know how many people need to be enrolled per academic year. These are all issues that birth registration are. And the problem comes now, if the manual registration, archiving is a problem, people keeping their own records is another problem. So if they come back to retrieve their data from the service providers in the health facilities and even at central level, some of the data are intact, but some are not. So you find it difficult, and it is legal to be registered twice. So the data must be there permanent. So when it is no more there, how would you call it permanent? So in order to fulfill that legal requirement, that's why the government feel it necessary, deem it necessary for it to go into digital. And this, it has worked with the partners, the World Bank. So you find it difficult, and it is legal to be registered twice. So the data must be there permanent. So when it is no more there, how would you call it permanent? So in order to fulfill that legal requirement, that's why the government feel it necessary, deem it necessary for it to go. And this, it has worked with the partners, the World Bank. So you find it difficult, and it has been registered and everybody is certified. That's the time we will to say that the old birth certificate will not be any more used, but it will still be a legal tender which will be used as a reference. It will be used as a reference. Which,
so we should not throw those ones away.
We don't have to throw it. Even our process now, after verifying the authenticity of that document, it is scanned and attached in your current profile. and then the certificate is returned back to you, so that for you, you have to keep it because it's a treasure. We even have in our records as far as 1889 records that are intact. And those people, they're no more alive, I think, scanned and attached in your current profile. And then the certificate is returned back to you, so that for you, you have to keep it because it's a treasure. We even have in our records as far as. So when he was asked, what are these people whom you call invincible? He said, people whom you know that they existed, they were born and then grew and then lived on this and died, and nothing had been recorded about them. So they become invincible. So and then this one is not only about invisibility, but now the legal identity of people. People, the data must be synchronized. From birth certificate to immigration, and they all need to be synchronized into your educational settings. All data, one identity should be one for individual. So therefore, the unique identifier that we are saying should be created at birth. That will follow individual throughout his life career. And it will be so unique in terms of identity, and there will be no identity theft, and then there won't be any query about age disparity, and then also legal documentations that people need to have. And it will also enhance in reducing even human trafficking, underage marriages. These are all things that it will do, and also ensure that people take their responsibility in terms of legal responsibility of caring of the children, because children are vulnerable, and other people that are all along the line are also being documented. So therefore, this registration has come for inclusiveness, and then our strategy is this. No one is left behind.
Absolutely.
We want everybody to be on board. Likewise, you mentioned about the health insurance. We're doing the concurrent way because it's a two-way to kill two birds with one stone. Because health insurance is under the custody of the Ministry of Health, and civil registration is also under the custody of the Ministry of Health. Providing services together concurrently. It is beneficial. It has economic benefits and also social benefits. One will come in a one window shopping. You have everything inclusive, and you have your health insurance that will be used in the later part of the services, which the agency responsible will come and clarify that one. But we are here to provide that service too, so that when there is need for it to be utilized or activated, then people have been registered and be issued with a certificate.
Okay, we'd like to talk to Lamin Sedikan, who is the logistic officer for the National Health Insurance Scheme. Can you please tell us, when you go to register for the birth, can you also register for the National Health Insurance Scheme simultaneously?
Yes, thank you very much.
Can you please hold the mic?
Yes, this is possible. When you bring in your information, your data that you brought to be used, you verify. If it is verified, that determines and qualifies you what document you should have. If you follow if you fulfill the criteria to get a birth certificate, then you will get a birth certificate and a national health insurance. Notwithstanding, if you didn't fulfill the requirements that are needed to get a birth certificate, you will be provided with a national health insurance. What makes you qualify for the birth certificate is you have to be a born Gambian to a Gambian parents, or you have to be born in the Gambia to a non-Gambian parents, or you have to be born outside Gambia to Gambian parents.
So just to clarify, you have to qualify for the birth certificate first so you can qualify for the National Health Insurance Scheme, or?
If you are qualified for the birth certificate, you will get the birth certificate and the national health insurance.
Okay.
You might be qualified for the birth certificate, you might be qualified for the national health insurance, and you are not qualified for the birth certificates.
Well, how is that actually
I will get
possible?
That is a non-Gambian, who is not a Gambian, not born in the Gambia, and has no lineage to the Gambia.
Okay.
That guy, and he comes, like say, a tourist.
An expat or something.
A tourist came here to stay here more than 3 months to 6 months, he'll be entitled to get the national health insurance.
Okay.
But he's not qualified because there is no linkage that qualifies him to get the national documents.
The birth certificate?
Yeah, to get the birth certificate. So he will be given a national health insurance.
Yes.
For the virtue of the time he will be here, so that whatever health implication that he might have, that the insurance covers, he will be covered in that.
Okay.
But if you are a Gambian, born in the Gambia, born to Gambian parents, or born to Gambian parents, but you are born outside the Gambia, you will be qualified to get the birth certificate and the national health insurance.
So how does the national health insurance scheme work? Does it come out of the taxpayers' money? Is it funded by the government? And should you just have the paper and you can go to any health this thing and actually get seen by a doctor? How does the national health insurance scheme work?
Yeah, I think.
Can we interject in that portion to clarify that area? The national health insurance is a scheme that will be run by an agency. Health has been hosting it. Is the pioneer. Health has been the pioneer of this insurance scheme.
Okay.
And then also come to the realization that there is need for it to be introduced into the Gambia. Knowing the health sector needs a lot of resources. And how it will be operated, we are saying in our introduction that the insurance agency will be able to come and clarify some of those ones. But what we are doing now as the Ministry of Health, we are enrolling people to give them the card, so that when the work starts, the agency start operating fully. They will come to the media and inform the general public the requirements and who should be eligibility of inclusion and what will be the premium will all be highlighted by that agency. But for here, our role is to enroll people, to register them so that they are prepared in advance, so that before the scheme starts, and then they are already enrolled, and then they will activate. I think that Jibril, who is the pioneer of the Ingenian, he's the architect of this health insurance, can shed more light on it. Thank you.
Okay. Perhaps before Jibril go, I just want, I don't want to give him a chance now. He will say a lot about it. But my point will be on that of Sidikan.
Yes.
I know in certain registration centers, somebody will see a non-Gambian having the national health insurance card, and these are the people who will go now to social media, because we follow the social media. We make sure that we screen, we will track the rumors and everything, and we respond. And these are the people, they will make noise and say, oh, the Minister of Health and the Gambian government, they are giving our documents, our national documents to non-Gambians. But those people who are qualified for national health insurance, they will get the national health insurance membership card, but they will not get the birth certificate because they are non-Gambians. So when somebody sees those people with the card, the national health insurance, they are not Gambian, but they are getting the national health insurance card.
Okay.
It doesn't mean that our document is given to non-Gambians.
Yes.
I want to make that thing clear here, because that is what we have been monitoring on the social media for the past 10 or 15 days.
Okay. Now let's get to the.
Allow Jibril to continue, and then we can come back.
It's okay. Thank you very much. I also want to talk about talk on what has just been mentioned. The issue around non-national being part of the process. You know, people have lived here for 30 years, and they have kids that are 25, 30 years.
Yes, old, yeah.
Also old, and they are born here. So they are also entitled to this birth certificate. So people should understand that seeing non-Gambians queuing to get, they are there for two things. Either the birth certificate for their children that are born here, or they are there to register to be a member of the health insurance scheme. So these issues need to also be clarified. And also people mistakenly take birth certificate for nationality. Birth certificate has nothing to do with nationality. As he has mentioned clearly, that every individual have the right for identity by name, surname, place of birth. You understand? So our birth certificate is clearly marked out the nationality of the father, nationality of the mother, and then the place of birth of the child. So it's a very clean and clear process and a very transparent process. So let people not actually panic. On the health insurance, that's going to be a different topic, you know, which we will deliberate more on the modalities of this operation.
You know, since you're a guy with IT experience, I saw something on social media, someone asking that, what is the Gambia government or what is the Ministry of Health doing with all this data, all our personal data? Who are they giving it to? Where will they store it? You know, these kind of things. Can you actually shed light on people's personal information being given out to the Gambia government?
Yeah. Thank you very much. Before I respond to that, you know, during the COVID-19, we opened an e-track, e-track that collect individual patient level data.
Yeah.
And 2 years on, that data is archived, kept saved by the Gambia government. And the same process that this also going to take, this data is also kept for decision making. You cannot plan for a country if you don't have adequate data. You cannot plan for a country if you don't have sufficient data. So your population dynamics.
Yes.
When you look at the registration process, you realize that there's a lot of variables that are collected in enrollment, especially the kids, the educational level of the individual that is being enrolled, we issued a new birth certificate. If at all you are a child, which grade you are. So all this process is important for government at the end of the entire exercise to know how many children are actually going to school, who are 5 years old, who are 7 years old, so that education department will be able to put in proper intervention to be able to fill the gap of those that are not actually going to school. So you will realize that all these data at the moment is archived online, it's on cloud server, and it's managed, stored, and controlled by a bona fide Gambian citizen, and they are all staff of the ministry.
Great. Good to actually clarify that.
At one point, birth registration is governed by an act, and these are biodata of the individual. It is confidential. We keep them confidential. That's why there is privacy and there is confidentiality. We don't disclose anybody's biodata to anybody. We only be sharing statistical data with any stakeholder. That's the only thing we are. But biodata will never be shared with any individual, because that's why there is no third party in this aspect. Our cloud hosting is, we control it, and it has to be a controlling registers. That's as per the act. We're going by that one, that let people be assured that their data is confidential and it shall never be revealed.
Okay.
Because that one, the law is governing it, that it should be confidential and then it should be private. That's why those who are not dealing this service are not given access. And those who are given access also having a limitation of access within the information. So that's why there's a control mechanism in place. And anything that you do, there's a level whose control what, and there's a vigorous monitoring in place. Mechanism is in place to monitor who even logged in the system. What have you logged, when have you logged, and what have you done in the system. So that all these are in place to ensure that the confidential aspect of people's data is being protected and then is preserved. That's the way we are operating, and that had been what we had been operating before, and that's what we continue to do.
Okay. Now,
I just want to also emphasize on that. I want to urge the public and advise them that they should disregard the audio that is in circulation, talking about the fact that we are providing the data to the Germans and then EU supporting this. That's the audio is going on. We just want them to disregard that information. It is not something that that the minister felt has anything to do with that. As rightly Fatih mentioned and Jibril, our data is well protected, and then let them be rest assured. Let them come out in their numbers and get registered, and their data is protected. And the data will not be shared with any other person outside the Gambia. So let them also, I want to assure them that.
Okay, we'll have to go for a short break now. The show continues in just a moment, and the lines will be open, and we'll be speaking in local languages in the next 30 minutes. So the number to call will be 3478089. 3478089. We'll take a short break now. The show continues momentarily.
yaa ngi am gàllankoor pour seetaan Eye Africa TV.
asalaamaaleykum askan wi ñu ngi leen di nuyuwaat fii si Eye Africa TV seen beneen jotaay musul.
soose pour ñëpp mën a actually understand waa ak Pul. Jola kan si yéen a dégg ma njaago fii nii kenn dégg fi njaago.
We can respond. We'll try to respond.
Okay, baax na amul problème. Léegi dama bëggoon a wax ñëpp ku bëgg a call am anything loo bëgg a laajte mën ngaa call 3478089 3478089. Léegi ma ñëw si Lamin B Fati muy the registrar of the birth and death certificates. Yan kayit la nit war a am pour mu mën a am this thing bii nii. Because ñëpp bu ngeen demee ba annonce ne ok léegi dañ am birth certificate bu ees ñëpp a jugandoor pour jaw daw dem def ni kayit bi so some ñu ngi wax ne amu leen kayit bi ñii ñu ne la amu leen kayit bi la lan la nit war a am pour mën a am kayit bii nii.
jërëjëf Baye loolu am na solo pour ñu leeral mbokk yi ne kayit soo ko bëgg a am dafa am yeneen charte yoo war a matal
waaw
soo matalee charte yooyu si lañ laa jox kayit
waaw
bokk na si loolu mu kayitu juddu boo xam ne la amoon nga ko
waaw
soo bëggaatee pour amaat kayit bu ees bii nii
waaw
boobu nga andi su ne mag nga dañu la laaj ne sa ID card nga àndale ko nga gis ni nombre bu fa nekk mooy lañ nombre dañ koo jël boole ko wala ko nekk si sa kayitu juddu bu ees bi ñu jox la kayit bi te duñ la laaj ci dara
ok dafa mel ni am koola asalaamaaleykum allo asalaamaaleykum na ngeen def ok we have to
kooku dem waaw ni ñu ko doon waxee su ne gune la dina di ñoo laajte kayiti noosam mën na ko àndale kayiti waajur pour wane ne waajur ñooñu ñoo ko jur ku nekk dañ ko totalee askanam ñu ko jur ñoo war a garanti ne ñii ñoo ko jur gune la
waaw
boo xam ne daal amaangul fukki at ak juróom-ñett
waaw
kooku dañ ko tombale ne gune la
waaw
ñooñu mën a ñoo registré seen bopp dañuy ñëwaale
waaw
bu ne amul kayiti alkaali kayiti noonu dañuy wax ne ma am kayiti alkaali
waaw
boo xam ne daal am na charte yu fa nekk kayiti alkaal bi alkaal dina ko bind tampe ko seet bi tampale ko nga gis ne nga teg si kayiti ay waajur ba nga àndaale ko si registration centre bi ñu registré ko jox la kayit
waaw am na nit ñoo xam ne dañ ñëw te amul kayiti seen yaay ok fana de am call asalaamaaleykum hello waaw na ngeen def hello dafa mel ni callers yi nekkoon di ñu dégga waaye ñu ngi dégga gaay waaye gaay yi nekkoon di ñu dégga so dafa am nit yoo xam ne den gis naa different post on social media ñu ngi wax ne man dem naa am naa kayit bi waaye awma kayit bi le gaay yi nangul ma koo jox
kayit moom charte rek la ñun lii nekku nañ dañ sos charte bi léegi charte bi loi nu mu ko teralee noonu lañ ko doxalee pour wane ne day yombalal ñi nii rek àggal seen buntu kër wala seen banta ba jox leen may leen kayit bi waaye dafa àndaale charte bi foog nga matal ñu ko matal ñu dañ leen a may kayit su nga xam ne nag mataluñ ko dañ leen a wax ne dangaay deelu nga matal yooyu charte yi soo ko matalee boo ñëwaatee ñu jox
ok so number one nga am indi sa old birth this thing bi
waaw sa kayit jur bu màgget
waaw boobu soo ko amut number two
boobu soo ko amul su ne gune la ñu ngay laajte kayiti noos bu ne tamit na mag la wala gune la sax bi fa amul kayiti noos ba tey bàyyu kenn si gannaaw da nga ne nga dem si seen dëkk foo juddu alkaali bi bindal ne si dëkkam nga juddu àndaale kayit boobu wane ne kii diw ñooy sa waajur because war a ñoo de xamal nañ kayit yu juddu dafay ñooy miraas si la nekk askan si la nekk waaw loolu yëpp foofu soo bëgg a askane nit ki foog nga junjal ko si dara dangay junj si dara mooy ne kayiti waajur mooy wane ne diw ñoo jur diw mooy wane ne mooy cher ne kii ñoo ko jur loolu moo tax ñu mën a tootale noonu balaa nga gis ne lu tax yow nga sant Caam wala bi tey man ma sant Fati suñ waajur ñoo tax di mooy wute loolu kon loolu fu mu amee rek foog ñu tootal nit ki ñu ko jur
ok baax na Mr Njie ma bëggoon pour nga wax exactly kii lu mu doon wax si soose
comme in dron lamin fati e mum fo jang sura kala ka kaytole fo miyalan ko abe kumala pour monde mi ngende tala registration lato o comme ba ibrahima yinin kam na walam ko modol ka folo ko ntara jele bari nga kayto do sa ba mon do sot e to nyalam ni ngenda bulu ka do sot la e be yinin kala kayto la ni wol samba be bulu ka do sot la ba national health insurance membership card mo jamabu je fa sa je mo bul mi an ka manke jan dingote bari ni aje sa ko bari ñun man se gunda fele ga kayto de mo le manke manga gambe dingote ba fele mo le ko wol ñanta wo insurance card da mala sot la bari wulu kayto to sot no la bari ma wulu jang bari ni dingo fanan so do fanan dingol wulu ta jang if c'est tano rangoto e ka kayto ngine dingol ye bari o mari asikeno e signal la goti bara manke gambe dingote bari ya jalbe rangoto aba mako kata ga puka dingol kayto ko topoto itika isna wulu ta social media de kayto ya fay fo ñokon e ko de tonya da nga mazakunda ka molta mi anko kadi kayto dila gambe kayto dila manka maga gambe dingol ko sifa jamal moy le lafta o fana sedanda molma adum na mari fana nganta kala amade be jan kare woro ko kala kasa ba kala fo kare woro kono ada be sirin janne ada manka jan kote abe national health insurance so dio fana bodde je fana e ngenda kado mi sama wala wulu kayto te dinno mi anko na man wulu kayto so ya do kado samba
fana len am kola assalamu alaikum. Hello? I think you should put the phone down. dafa am loo xam ne dama ko bëgg a wax képp kuy call sooy call wàññil sa télé bi wala da nga koo sori tuuti because soo taxawee si sa boori TV bi ngay call we can hear you and you can hear us. yaa ngi understand so please sooy call just stay away from the TV or nga wàññi volume bi bu baax a baax a baax monsieur Ndiaye. waaleykum salaam. jaama rek alhamdulilah. ok baax na jërëjëf. baax na jërëjëf loo bëggoon a laajte. waaw. 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 waaw ok loolu dinañ bàyyi Ndiaye ok dinañ bàyyi kii Mr Fati moom mu tontu loolu. mën ngaa teg
boobu si gàttal li ñu bëgg a wane ne mooy ne su ne am nga sa ID card ak sa kayitu juddu.
waaw
boobu soo fa yemee su ne kayitu juddu amul benn tafaar.
waaw
dara yàqut ci.
waaw te
lu baax la. lu jag la loolu dañ la jox kayitu juddu bu es bi nii. du jar nga dem ci alkaali.
waaw
jarul nga dem ci alkaali.
ok waaw because dafa mel ni dafa am nit yoo xam ne dañ foog ne da nga war a yóbbu ñetti kayit yow noonu yëpp da nga ko war a yóbbu. kayiti alkaali kayiti juddu ak sa ID card.
ne loolu sarta bi nekkul noonu dañ yombalal mbir mi yëpp.
waaw
képp koo xam ne daal matal nga sarta boobu. boo si la ñuy wax ne mooy kayitu juddu bi bu màgget bi boo ko amee.
waaw
boobu lu su ne mag nga dañ soxla sa ID card su ne gune rek jarul soxla kayit lu ñu soxla mooy sa kayiti waajur pour teetal ne yow ñu méngool leen ak loolu.
kon xale su ñëwee ak kayitu juddoom. foog mu indiwaale.
dafa indiwaale waa kayitu juddu parce que moom amul benn kayitu seerne buy wane bu dul birth certificate bi loolu dañoo seet ne tur bu nekk si kayitu juddu bi ndax moo nekk si kayitu waajuram.
ok kon
loolu foog naa foofu la ñu bari di am di réeru.
waaw ok waaw ok kon Ndiaye dafa am loo xam ne dañ ko war a clarifier because speaking of social media and rumors gis naa benn post boo xam ne nit mu ngi wax ne moom dem na mu yóbbaale his birth this thing and the ID card waaye moom yaayam ak papaam den gaañu so moom mënutoon a yóbbuwaale ñooñu gars yi seen lifin their papers so gars yi dañ ko xañ pour mu am lifin bu ees bi so
xaaral ma leeral boobu
waaw
su ne kayitu juddu bi baax na
waaw
lu ñu wax ne si suñu charte bi mooy ne jarul kayiti waajur yi gune la ñu wax gune xam nga kay ku xam ne daal waaju su ne kayit
it's under 18 waaw
su ne under 18 su ne amee kayit juddu rek du jarul
why there are people who are like 17 years old and they orphans
léegi jaraatul ñooñu su ne kayit bi juddu baax na ñu leen laajaat kii nii kayitu waajur yi
even if they are under 18
even if they are under 18 ñoo xam ne daal dañoo bindu am yeneen kayit yoo xam ne daal amuñ kayitu juddu
ok
ñu ne kayiti alkali ñooñu la ñoo laajte ñu indaale kayiti seen waajur waaye bii nii yow su ne kayitu juddu bi bu nga amee ba pare wane na sa kayiti waajur sa turi
waajur waaw
boobu la ñoo jël di ko beesalaat boobu duñ jëlaat ñu laajte
ok baax na asalaamaaleykum waaw aleykum salaam jaama rek alhamdulillah jërëjëf waaw seen doom yaa ngi juddoo Égypte waaw ok waaw
waaye ñoom dañoo bañ ko defal ñu ba certificat dañ koy dem si suñ ambassade bi
waaw
ñoom ñu seen Gambia defal ñu ba certificat bi ñoo leen dinañ la defal tey boo xam ne foofu nga juddoo rek waaye doo am ba certificat te man li ma gis ni pare na si yëpp nga am ba certificat mu jàngal ma trop
ok
parce que dina la oome la fii nii sax du Gambia
ok baax na
jërëjëf mun yaa sant bu baax sa laajte boobu li ñu laa mën a wax rek képp koo xam ne juddu nga si biti waaw te sa yaay ak sa papa yëpp Gambien lañ ñooñu dëkk boobu dañ la jox kayit dañ la jox birth certificate fi nga juddu
waaw
kayit boobu nga isi fii moom la ñaari gis woon na ne yow sa papa ak sa yaay yëpp Gambien lañ waaye waaye dañ yow da nga juddi beneen waaye dañ leen jaa kayit bu ñu laa jox dafa wane yow da nga judd si biti mooy bi born outside the Gambia ñu bari mun naa gis ne tamit ñu xam ne gan la boo xam ne am na kayit boobu waaye xiñ na koo xam ne tamit dafa ñëw fii waaye mu am kayit boobu non gam NGP tam mu fa nga am ko xam ne dafa judd fii waaye parents am nekkuñ Gambian ñu ko non Gambian parents waaye ku gis ne mu am kayit boobu rek dafa ne woon ñi am na kayit waaye soo xoolee kayit bi ci chat bi dañ ko dee binda foofu na su nekkee BOG la mooy born outside the Gambia boo dafa nekk man ñoo ñëpp bokk nañ si amee seen doom yi suñ doom yi mun na am nga dem jàng feneen nga am fa doom boobu soo ñëwee foog nga kooku da ko war a gis ko Gambien la waa ko dafa judd si biti waaye sa papa yaayam ak papa yëpp Gambien lañ waaye am na ñoo xam ne tamit noonu Gambien parents ñooñu parents yooyu yaay ak papa nekkuñ Gambien waaye dañ ko jokkee waaye yëpp si cat bi la nekk soo xoolee cat bi rek dafa laa wane waaye koo xam ne mu nga am kayit boobu nekku ne foro lañ ko
asalaamaaleykum hello asalaamaaleykum
aleykum salaam
aha
na ngeen def
jaama rek alhamdulillah
naka jógee si kawam
sant yàlla loo bëggoon a laajte
the question I want to ask
wow
that is whether this aleykum salaam
whether
the question I want to ask that is the program is very interesting and it's very very good
yes
it's starting with the Gambians the question I want to ask
yes
that is whether these new health insurance anniversary if you don't get it you can't travel or
okay, I will let Mr. Jaju actually answer that, and we just have 2 more minutes to go. So, can you do it briefly, please?
jërëjëf kontaan naa torop si waxtaan bi. li ma mën a wax si loolu mooy ne ba certificat bii nii soo ko amut ba léegi mun ngaa tukki dem sa soxla. waaye ba certificat bi dafa am solo torop pour képp Gambien pour mu am ko képp koo xam ne juddoo nga fii da nga war a am ba certificat bi pour wane ne yow si réew mi nga bokk soo loolu dafa important ñaaka am ko nag du tax du tax ñu xañ
waaw ñu xañ
waaye am na benn laajte tamit boo laajte bu Mr Fati waxoon mu ne képp koo xam ne wane nga kayitu juddu bu baax bu màgget boo xam ne baax na yow solowloo dara pour wane dañoo wéccee kayitu juddu bu baax ñu jox la bu ees waaye ñu bëri dañ ngee tampa mooy ne da ngaa gis bu màgget ñu bindaat foofu noonu dañ laajte waat documentation balaa ñu jox la
ok xanaa dañ am call asalaamaaleykum aha
Yo.
Okay. Abaraka bage mbadi mba fole ko don dugare amanjara ye fang batandi ni kuya askeno mebi kiam ko le mudi bari mba fole ko kana pisale binala le ninti mo sansa nyin tembe sama na timo bi da foñile e be tarala kabo block kada fo sinter kada kallaji e be tarala je fo til fo septembre karotil tang ni o bandron e be murana binala leptan do ngala ngebe sukuta leptan de be tarala je na timo be tarala comme nundo lu kado kadi nyame ngul leptan to o kilo be continue ko de bari be tarala leptan to jele so momoro de ngebe dawo da leptan suta da jela e bala ko timo lo murada ko kabo septembre karotil tan ngelen fo kada septembre karotil tan sama so mo kana kamun ka ko ba ni di bodo janta so da ko ngani momoro ni ba sobdal adum ne fanan tambe da ko nge lu kado debe be dilla ko leptan do tare wato wade so mba ilaw ngin ka be da bakala ko mada baga mba fala la ko fanan moboran ke be foñi ka bo block kada bo center kada kallaji e albese na luntangol ibina sama e be wulla be futal alla sada wolto dukare nga kada dron nyonyo makoy nga mute fe nga do ko sonano nga rangol de da kuche ba nga lan ko to nyarne kada dal men ko wol dalta kam sakunda do kula
I think we have a caller. Assalamu alaikum. Hello.
Okay, what are Hansa?
Hello. Hello. Wah, Halo, assalamualaikum. Lo bukan ala cek? Okay, I think we can stop the phone calls for now, since we just have about 4 more minutes left, so we can just clarify a few things here on the table. First of all, what I want to clarify is gox yoo xam ne ñëwoon ngeen fa ngeen jógee fa ngeen dem ndax gox yooyu noonu di ngeen fa ñëwaat
dinañ ñëwaat loolu laa wax ne mais léegi fu mu nekk nii suñu team yaa ngi pare ëllëg pour dem fooñi waaw léegi ñoo ne fanaka ba septembre fukki fan foofu lañ ko jeexal dañoo ñëwaatee léegi suñ ñëwaatee dañoo dem si lépp fu ñu demoon dañoo tax si lépp tan yi la ñoo nekk comme que lay Bakaw Sukuta Serekunda si syndicat bi Josuang Old Josuang New Josuang ay Gunjur foofu la ñoo nekkaate
léegi gars yi du ñëwaat si jumaay wala si seen
lépp tan yi la ñoo nekk comme que nit ñi xam ne dëgg kayit de juddu time boobu suñ ko solee lépp tan lañ ñari dem léegi nag nit ñi xam ne tey foofu la ñoo demaate pour am kayit de juddu so moo la ñu ngi ñëw ba su septembre jeexee la ñoo commencé xam naa gars yi ñoom ñu ngi yàkkamte ñu ngi laajte gars yi ba bu ñu ngi laajte gars yi siyaara ñu ngi laajte waaye ñu xam ne suñ fa jógee rek septembre su jeexee rek octobre la ñoo commencé boori North Bank noonu la ñoo demee nag bañ jeexal
ok waaye nekkul ne da ngeen ko decentralize pour gox yi all the 7 regions ñëpp ñoo amal ko
at once déedéet dañoo danka la ñoo demee
danka ngeen a demee ok so léegi ñu ñëw si Mr. Lamin B. Fati, who is the registrar. Can you please say your final words before we let go of you?
What we are urging every individual is to ensure that they take this opportunity to register and be issued a certificate, and assure the general public that the service has come to stay. And the rumors that is that after this one, the people will, the user fee will be so exorbitant. We are not here to put a burden on the people.
It's not for sale.
No. Birth certificate have been in the country, and then the fee had been very minimal.
Yeah.
And if there will be any user fee anytime, that will the information will come from the Ministry of Health.
Okay.
And then the general public will be informed, and it will not levy any individual or service that the people of the Gambia cannot afford.
Okay, to Mr. Lamin Seydikan, can you please tell us, nit ko mel ni man, for example, yaa ngi toog nga tayala jaar si rang boobu noonu, even though gars yi ñëwaat nga tayala jaar si rang boobu noonu, soo toogee, for example, fii ba 2023 or 2023 by December, can you still go and get yourself a birth certificate?
Waaw jërëjëf Baye loolu mën nga ko am waaye ndax yow li nga soxla jamono boobu ñooñu li ñoo laajte si yow ndax jamono boobu dina fekk yow nga amee birth certificate loolu moo tax ni ngay ñaan mbokk ay yëpp ñoo ngi ñaan ñëpp pour ñi nga xam ne léegi ñu ngi dem si gox yi ñu ngi dem si palaas yi ngeen génn ñëpp ñëw muñ ak ñun
ok gaay am ko
ñu jagaral leen kayit yi jox leen ko yéen ñëpp am ngeen ko loolu mooy suñu jublu
baax na jërëjëf ok that does it for this edition of the National Health Insurance Scheme and the birth certificate panel discussion. Till we come your way next Sunday, same time, same place. We'll be on all TV stations, and you can call in and ask your questions with regards to the National Health Insurance Scheme and birth certificate. I'm your host, Ibrahim Cham. Many thanks for watching. See you next Sunday. Bye.
yaa ngi am gàllankoor pour seetaan Eye Africa TV.
asalaamaaleykum askan wi ñu ngi leen di nuyuwaat fii si Eye Africa TV seen beneen jotaay musul.
mbokk yi ñu ngi leen di nuyu fii si Eye Africa TV seen programme